A lot of people think that a negative STI test means that they're in the clear. But here's the thing. If chlamydia is dormant, it might not show up yet. It can still be totally negative in your body for months and you show no symptoms at all. In this video, we'll explain what that means, how to spot the warning signs, how to protect yourself and your partner. Hi, I'm Dr. Fuller, medical doctor as well as certified sex therapist. Chlamydia can stay dormant, but the effects are real. Check out our full playlist for more videos on how to spot it, treat it, and prevent it from coming back. What does it mean for chlamydia to be dormant? Dormancy in sexually transmitted infections means the infection is present but not causing noticeable symptoms, so you can still transfer it to your partner without knowing. It's different from an incubation period, which is the time between exposure and the first possible symptoms. Dormant chlamydia can go unnoticed for months, sometimes even longer. So how long can chlamydia stay dormant? The incubation period for chlamydia is usually 1 to 3 weeks after exposure, but the infection can remain asymptomatic for months or even years. So some people never show any symptoms at all. That's what's called being asymptomatic. So a common question that we get is, what are the symptoms of chlamydia? In the early stages, you might notice mild symptoms like painful urination, unusual discharge, pelvic or lower abdominal pain. So if left untreated, symptoms can become more intense over time. So for women, this might include bleeding between menstruals or pain during sex. So for men, the symptoms can include testicular pain or swelling, but again, you might be asymptomatic, meaning you will not experience any symptoms at all. So what are the risks of undiagnosed or dormant chlamydia? If your chlamydia is asymptomatic or dormant or undetected, it can cause serious long-term damage. So for women, it can lead to PDI, pelvic inflammatory disease, which can scar the reproductive organs and cause infertility or ectopic pregnancy. In men, untreated chlamydia can lead to infertility and chronic pain. And even being asymptomatic, meaning without symptoms, you're still at a risk of transferring it to other partners. So how is dormant chlamydia diagnosed? Even if you're symptom-free, STI testing can detect chlamydia with a simple urine sample or swab. So most individuals will get tested once a year if they just have one partner, or if you have several partners, we do recommend getting tested every 3 to 6 months. So knowing your status is the only way to catch dormant infection before they cause damage. So how is chlamydia treated? So the good news is chlamydia is easily treated with antibiotics. Just make sure to finish your full prescription as the doctor prescribed, even if you feel better before you've completed your medication. And don't forget, your partner needs to be treated too. Otherwise, you can pass it back and forth. So how do you prevent dormant chlamydia infections? 1, use protection. So condoms and dental dams can help reduce the risk. Getting regularly tested for sexually transmitted infections is important, especially if you're sexually active with multiple partners. And honestly, don't skip the awkward conversations. Talk to your partner about the testing and talk to your partner about your results. It's the safest move for both of you.